Next we have Chelsia and Helena. It talks about the Affordable Health Care Act, otherwise known as Obamacare. It says cancer patients and survivors need affordable coverage that will cover their treatment and follow-up care. Will you pledge to vote against any repeal of the ACA that doesn't include simultaneous replacement plan that covers cancer patients and survivors? The short answer is yes. I think one of the real advantages of the ACA is it took off lifetime caps. For the folks that have somebody that has cancer in their family, which is probably everybody on this Facebook Live, knows somebody that has had cancer. Once you hit a lifetime cap under the old system, they'd kick you off. So when you needed the health care the most, you didn't have the health care. What the ACA did is remove that lifetime cap. If you got cancer, you hit that cap no matter what figure it was. They couldn't kick you off. They had to keep covering you. I think that's very, very important. I also think covering of pre-existing conditions is very, very important. I also think being able to keep your kids on the plan until you're 26 is very, very important. All those things are in the Affordable Health Care Act. And I can tell you that I will never vote to repeal the ACA unless we have a plan that increases, and listen to me, access. So if you live in a small town, you got to have access. Otherwise, you're not going to be able to live there if you're over the age of 50. And affordability. And that's a big, big part. Now, I will also tell you that I've had a number of sessions around the state of Montana over the last couple months talking about the Affordable Health Care Act. And I've had a number of people walk in and say, you know what? Because of the ACA, I can't afford my health insurance anymore. I'm paying $2,000 a month and I have a $10,000 deductible and it's going to cost me, $24,000, $34,000 before I can even afford to get sick. Look, that is a huge problem, and we need to address that problem. I can tell you that's more of a problem with insurance than it is with the ACA, but nonetheless, regardless who is blamed, we need to focus on that problem. And I think we can. I think there's some things we can do with transparency in prescription drugs. I think there's some things we can do with insurance company transparency that will help drive those premiums down. And there may be some other things we need to do to tweak the ACA to help drive those premiums down. But to throw away the entire ACA without a replacement, which is where we're at right now, would be a huge mistake. And that's what I heard when I went across the state of Montana also, with few exceptions.